Through his Emmy-winning television show and a series of books, Dr. Barry Brazelton gave millions of parents insight into their children's behavior. The Harvard Medical School professor of pediatrics emeritus, who celebrated his 93rd birthday this year, is still working to promote healthy child development through supporting good parenting. After 4 decades as a pediatrician, he founded the Brazelton Touchpoints Center at Children's Hospital Boston. The center trains pediatricians, social workers, and preschool teachers, but also cooks, bus drivers, and family court judges, any adult who interacts with young children and their parents. Brazelton called the center's approach Touchpoints because it views each interaction as an opportunity for connection and learning. During the last 15 years, at least 10,000 adults have been trained, and 130 facilities around the world have incorporated Touchpoints into their staff training. In this slideshow, we'll take you to one of those sites. Little Sisters of the Assumption Family Health Service, located in New York City's East Harlem neighborhood, serves a very poor and immigrant-heavy population. To help create a supportive environment for the neighborhood's disadvantaged children, Little Sisters sent staff members to be trained in the Touchpoints approach. Touchpoints teaches that children are embedded in a web of relationships. Therefore, providers must consider the whole child and not just the limited context in which they interact with the child. A teacher doesn't consider only academics. A doctor doesn't consider only medical issues. This is part of why incorporating Touchpoints wasn't a stretch, says Little Sisters Executive Director Gary Carter. The agency offers a range of programs, including GED classes, English as a second language, Spanish as a second language because many immigrants from Mexico speak indigenous languages, legal services, after-school tutoring, and programs on nutrition. Clients who take part in one program are screened for other services. True to Touchpoints, staff members at Little Sisters don't stop at the edge of their official responsibilities. Home visits are the core of what Little Sisters does. The visits give social workers and nurses a chance to observe conditions in the home, not to catch parents doing something wrong, but rather to get a more complete picture of how to serve the child. In these scenes, Sister Suzanne DeLee visits Susanna Saldivar and her 4-week-old son Xavier. DeLee is evaluating the boy's development, weight, height, and motor skills, but another purpose of her visit is education. She is not so much imparting information as validating Saldivar's parenting skills. Touchpoints teaches that parents are experts on their own children, and they only need to be guided to trust their own instincts and to see the knowledge they already possess. DeLee reassures Saldivar that she doesn't need fancy toys for Xavier to play with. A simple bottle of pills can work as a rattle. And she doesn't need special instructions for soothing him when he fusses because her intuition has already taught her how. Little Sisters staff get to know their clients well. Social workers Katie Morocho and Sarah McClanahan visit their clients, Sisters Zenaida and Celia Vega, and the women's 4 children twice a month. On these home visits, the social workers engage in directed play and offer parenting advice, but they also look out for signs that the family might need extra help. On a recent visit, Morocho noticed that Zenaida Vega seemed depressed. With most of her extended family far away in Mexico, Vega was feeling isolated. Realizing that depression can affect parent-child interactions and hold back healthy development, Little Sisters offers mental health support groups and counseling referrals, but Morocho also decided to offer her clients some practical support. She brainstormed with Vega about job possibilities that might help her find professional fulfillment. Vega decided she'd like to work in a bakery. One problem, never in her life had she even baked a cake. Morocho started at square one. For her next visit, she brought a store-bought cake mix and guided Vega through the instructions, with mouth-watering results. Ray Lopez and Eric Hinderly are environmental health workers for Little Sisters. They help rid clients' homes of pests such as bedbugs, mice, and cockroaches. A visit to Josefa Candia's home highlights several of the problems Lopez and Hinderly commonly face with their clients. Landlords refuse to do anything about the infestation, or they fumigate with harsh chemicals that are health hazards themselves. Candia shares her apartment with another family, so no matter how careful she is, she may not be able to control conditions completely. For clients like Candia, it is easy to feel embarrassed about cramped living conditions and ashamed of pest problems, but she is more likely to take the worker's advice if she feels supported rather than defensive. With Touchpoints, Lopez and Hinderly have learned how to put people at ease and diffuse status discrepancies, so Candia will feel that the Little Sisters workers are on her side, helping create a safe home for her family, including the baby daughter that will arrive soon.